Thank you so much, Chloe, and good morning, everyone. I'm going to open us up today. Unfortunately, Dr. Bello is attending to an emergency situation with a patient. He was supposed to open it up for us today, but we'll just keep going like we normally do as a team. So we have the slides up. Again, I just want to say thank you for inviting us here today, and good morning from Alberta, which is the territory that includes Treaty 6, 7, and 8 and the Métis Nation of Alberta. And specifically for myself and the majority of the team that's here today for Kidney Health Check, we're situated on the traditional Blackfoot territory in Calgary. And so on this slide, like Chloe introduced us, you'll see the names of the people involved in this project, and you'll hear from us as we go through the co-creation journey that we've been through over the last few years. So we'll go to the next slide. So learning objectives for today are listed on the slide, but in a moment, I'm going to hand it off to Elder Harley Crowshoe to start us off in protocol. After that, in our presentation this morning, we'll describe the background of creating harmony in care and how that project came together. We'll share details about kidney health check screening and how it aligns with creating harmony in care, and also how this screening has been carried out in 2 First Nations communities in Alberta. At the end, we'll share some of the lessons that we've learned and the recommendations for reconciliation before we close in protocol again. And so with that, I'll hand it off to Harley Crowshoe, Elder Harley Crowshoe, to start us off in a good way.
Thank you, Lena. Good morning. I just wanted to say, so honored to be here. And, I had a chance to listen to some of the stories yesterday, and they were just incredible. I really felt it in my heart when they were talking. I'd like to thank the speakers for that, for taking the time to share. As we were working on this project and on this journey, we learned a lot of we gained a lot of knowledge and really learned the importance of working with the elders and gaining that understanding and knowledge, and also the sacred wisdom that they provide. And in honor of those elders and the teachings and guiding us, I want to start our session off with a prayer, with traditional protocol, because one of the teachings they gave us was, when you're working together and developing things that are going to be meaningful to help people, you have to do it in ceremony and use that protocol throughout. So today I'm calling in from my nation, the Piikani Nation in southern Alberta. My Blackfoot name is Gayupika, which is bear child. And I'd like to just share a short prayer with you to get started. And I'm going to use my eagle feather and the tobacco that was gifted to me, and just ask the Creator to be with us, watch over us during the next couple more days of these sessions, but also for today as we present, to give that clarity and that understanding, and to be able to include those meaningful words that help heal and help guide us. So with that, I'll start the prayer. I'll be saying the prayer in English. Creator, Grandfather, you're known by many loving names. I, Gayupika, come before you in a humble way, with tears in my eyes and ancient song in my heart. I pray. I pray to the powers of creation, to Grandfather Sun, to Grandmother Moon, to Mother Earth, to my ancestors, the holy grandmothers and grandfathers. I pray for my relations in nature, the ones that fly, swim, crawl, and walk, and the ones that are seen unseen, and to all the good spirits that exist in all parts of creation. Creator, thank you for this beautiful day. Thank you for bringing us together in this way so that we can share and learn from each other, so that we're able to see those important pieces and the important work that's being done to help us in kidney disease and the many health issues that we that are challenging our communities and our families. Thank you for the gathering that we're having and be able to share some of these practices and models. I ask you to be with us, Gray. Watch over us and watch over our families who aren't able to be with us. Ask you to, protect them and give them good health. But I ask you to watch over everybody here as we journey together, as we get to know each other better and gain the knowledge we need and understanding of the various practices and processes that really help us in that healing, in that wellness. Be with us today, Creator. Ask for beauty above us, ask for beauty below us, ask for beauty around us, ask for beauty each and every one of us here today. All my relations. Thank you.
Thank you so much for that, Harley. And so we'll bring it back to the presentation, and you'll see as we pass the information along and each present kind of the role that we've been playing within this co-creation of this project. So Elder Harley Crowshoe has been playing an essential role in guiding us throughout these last number of years. I'm Lene Jorgensen, and I'm the lead of the project. This project spans many changes in Alberta that have happened in the health system, but because of the strong partnerships and commitments we've made, we have been able to transcend some of those changes both within the system and beyond, and also changes within the communities and beyond. So to set the context for Alberta a little bit, Alberta is the home to 45 First Nations communities and 8 Métis settlements. The work we'll share today includes how we started with 2 First Nations communities in southern Alberta, the Piikani Nation and the Blood Tribe or Kainai Nation. Both of these nations belong to the Blackfoot Confederacy, and we'll share how we continue to expand the screening to communities in northern Alberta, as you can see listed on the slide. We'll go to the next slide. So kidney health check is point of care testing for diabetes, hypertension, chronic kidney disease, and obesity, where the screening takes place in the community and the results are provided to the person in the moment. The kidney health check protocol for Alberta was initially created in 2017. And creating harmony in care is an approach that integrates Western care with culturally relevant practices. And this was co-created in collaboration and in consultation with Indigenous communities, partners, champions, and elders in Alberta. This approach was developed in 2020, and at that time, we joined the 2 initiatives together. We worked with the Blood Tribe and the Piikani Nation to co-create what the implementation of kidney health check screening would look like, and we'll go into that in more detail in a bit. But this slide also shows a little bit of the timeline from 2017 onward and the different steps we've taken, and it also shows some of the many partners that are involved in the work. We'll go to the next slide. But we'll just take a little bit of a step backwards. And as I mentioned on the previous slide, creating harmony in care was initiated in 2020. The reason for starting that work was the fact that the rates of diabetes and diabetes-related complications, such as kidney disease, blindness, and lower limb amputations, are significantly higher among Indigenous peoples and in First Nations communities in Alberta when compared to non-Indigenous Albertans. In addition to that, we also know that the inequities in determinants of health, such as lack of access to healthy foods and lack of healthcare services, contribute to these higher rates and contribute to people developing the condition sooner in life. And we also know that this results in Indigenous peoples often progressing to severe disease states more quickly. So the data in 2020 showed that almost 15% of First Nations peoples in Alberta had diabetes, compared to 7% for non-First Nation Albertans, and that lower limb amputations and kidney dialysis rates were 3 times higher. But beyond the statistics, we heard stories about people dying from diabetes-related complications because of lack of services in their communities. We also heard from elders who had lost limbs as a result of diabetes complications, who expressed that losing a limb felt like losing their spirit. So creating harmony in care is designed to ensure that we pay attention to both Indigenous and Western ways of thinking and doing, with a focus on the factors that help people live a healthy life with or at risk of chronic disease. Creating harmony in care is founded in co-creating local solutions in collaboration with stakeholders such as elders, healthcare providers, and community champions, and is founded in the importance of coming together in ceremony like we just experienced at the beginning of this presentation. The Creating Harmony in Care logo shows a balance of Indigenous and Western approaches. The feather represents how elder guidance work in harmony with the 4 icons on the other side. These icons represent the areas that we must pay attention to related to the person, the care, the community, and the system in order to create harmony in care. And we'll also share more about this later in the presentation. We'll now share a little bit about how our creation journey bridged the gap between Indigenous knowledge and Western practices, and included capturing stories and wisdom in graphic recordings. And with that, I'll pass it back to Elder Harley Crowshoe.
Thank you. Just give me 1 second here. Perfect. Yeah, and as Lena said, we explained why we were doing this work and what we've been doing, but also really focus on how this work was done. As we came together as a team, we all had different types of experiences and knowledge, and it was quite diverse. And also the willingness to really delve down and really take that next level of understanding and be able to start looking at, what do we need on this journey and how can we, work together and create something and co-create something that's going to be meaningful and really focus on the health and the well-being and the healing of the community and the patients or the clients that are on their health journeys. So as we, you know, moved down that journey or that path, we looked at those cultural practices and we looked at, what do they mean and gained a better understanding. And, especially the traditional ways. And, it was an opportunity to really gain that understanding and also allow for us to be able to catch glimpses from an Indigenous lens and make it more meaningful and be able to, capture the the steps that we need to take as we move in the future. So as we continued on that journey, we realized and understood the value of that sacred wisdom that the elders provide and how they can guide us and give us, that knowledge or help us understand that knowledge and the steps that we need to take and what co-creation really means and what partnership really means, and when we look at that and how we can work together. But we needed to understand the past. We needed to understand some of those ways that help us that we had in the past that helped us create that harmony in our community. And we needed to, incorporate, ceremony into how we, you know, develop this model and how we work together with the community. We needed to respect those traditional protocols that were needed to be part of this. And the elders helped guide us there. And we looked at many things. We looked at, you know, that the steps that we needed. We looked at what bundles were. We looked at, gaining a better understanding of that sacred circle and the stories and the teachings and how to live life in a good way, in creating that harmony within ourselves and within our community. We looked at, how do we strengthen our spirit so we're ready to take on the health journey? And what do we need on that journey? And those are the many conversations we had. And when we captured it in these images, it was, we were able to sort of see that progression of that journey as we move forward. And ultimately we wanted to ensure that we did it with respectful understanding. And we wanted to ensure that that journey included, how to care for each other in a caring way. And if we move on to the next slide, we our discussions evolved over a couple of years, and we looked at different practices and processes, in a deeper way, and we look at the concepts that were important on this journey, and certain models that we could, consider being part of what we're developing. We looked at, with the guidance of elders of, ceremony. Ceremony is so important, and we looked at, we need to ensure that ceremony is part of this whole process from start to finish. We looked at the traditional protocols that were needed, and we looked at the different ways of how traditional healing and wellness, is in our community, and the different practices from our traditional ways that incorporate that. So we talked about the pipe, and the meaning of the pipe and the sacredness of the pipe, and how that smoke from the pipe carries our prayers to the Creator, and how the ego spirit carries those prayers in such a loving and protective way to the Creator. We talked about the meaning of smudge and the importance of smudge to calm our spirits, to give us that calmness in our spirit, and be able to let go of the things that we carry so that we're ready to meet the day and deal with what we need to each day as we move forward, whether we provide services or we're the clients where we receive those services. But the ceremony of that smudge helps us in our lives. And also we talked about bundles, what the meaning of those bundles are, and the many types of bundles that we have in our community, how sacred they are. We talked about and gained better understanding of the medicines and sacred plants that help in our lives, and these are all gifts from the Creator. And as we took that journey forward, we looked at that, that the four directions. We looked at the circle teaching, the circle of life, and how important that is to create that harmony in our lives. And we looked at, those, how we come into this world and how we grow and take responsibility. And as we journey, how we need to look after ourselves and be healthy so that we can help our families and the other people in our community around us. And as we journey forward, how we gain that knowledge and those skills, and how we share and pass those on to the younger people before we go back to the Creator. So all those stories and teachings were so important during this journey of gaining that knowledge that we need to really understand what are the steps that we need to do to create harmony in the community, and look at the kidney disease and how destructful, and how it impacts our communities throughout you know the I guess the province and throughout Canada, and how it really affects our elders. And we'll turn to the next slide. We looked at, and just carrying on with that conversation, we looked at what are those centering of needs. What kind of resources do we need in the community? And we were focused on the Pigani Nation, which is my nation. And some of those stories that we've been hearing, and in my past life and other jobs I had an opportunity to be in my community working. And I would sit down with the elders, and the elders would tell stories of, life and share teachings and share a little bit of the past and share those moments that were so special to them. And then I left for a period of time, and it was probably a good 20 plus years before I got back. And when I sat down with the elders, that the stories changed. What they shared shifted to the challenges they were experiencing in their health, in dealing with these chronic diseases, in dealing with the cancers that exist in our communities and how they're starting to be more prevalent, and 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 focused on the diabetes, how they've lost limbs, and how it's you know some are on dialysis, and they really, the story shifted, and because of that, we need to take the time to understand that change and take the time to really look at how do we change that story to be positive. And it takes many partners to do that. It takes the whole community, and we need our elders to guide us to be elder led, but also Indigenous led, because we have a lot of, you know, partners within the community that helps deliver that quality service. But we need to also change how we deliver that service so that they're more, you know, culturally safe and responsive to the needs of each and every Indigenous community. When we looked at the stakeholders, the partnerships, how do we develop better partners, real partners? And how do we, develop meaningful programs or delivery of service? And the only way that we can do that is working together and co-creating this journey together. We looked at what kind of partners do we need to bring in or we need to develop. And we focus on, if you want to call them stakeholders, we looked at, those programs that exist out of our community, and we needed to get in touch with them and bring them in to be part of that partnership. Whether it's, at that time it was Alberta Health Services in the South Zone, but also the SCN and the PCNs need to be part of that journey and that conversation. But the elders need to be, front and central. And the community champions are part of that. So those are just a little bit of those steps in the journey where we were taken. And we'll go to the next slide. And through that all, what emerged was the importance of the sacred bundles. Because the bundles in our community, they help create that harmony, and they focus on healing for the families and the community. And we wanted to see what would a bundle look like for our community members that are dealing with, for instance, kidney health or kidney disease. And we focused on what would a personal bundle entail? What would be in that personal bundle that would help support and help with that health journey for our community or for our patients or our clients? And what would that community bundle look like? What kind of supports and what kind of, the elders are part of that, and there's different types of supports that are being delivered that can be part of that bundle. But also with that, the care bundle, how do we, provide services that are, meaningful and understandable? And how do we prepare those clients for, the Western medicine? And how do we support traditional medicine and Western medicine so that they work together in that health journey of the clients? And within all of that, what's weaved in there is that sacredness, and that's that sacred bundle. And when we look at that, that sort of resonates with our community. It resonates as to how we could deliver a model that would work in with many Indigenous communities, because it can be customized to work for and to capture the way they do things in a way it connects to their culture and their traditions. So that's just a little bit of this journey, and it was quite a journey from start to finish. A lot of learning, a lot of knowledge, and a lot of conversations with the elders and uh, various Indigenous champions, whether they were, Indian First Nations, Inuit, or Métis. We had that opportunity to really hear that voice as we journeyed on. So thank you.
Thank you, Harley. So now that we've explained a little bit about the why and the how of what we did to within the work to creating harmony and care, this is the actual creating harmony and care approach, which you can see is the 4 bundles that Harley has just shared with us, and it includes what's contained in those 4 bundles. And that includes using evidence-based care that is both traditional and Western, capturing wisdom, knowledge, and solutions that already exist in Indigenous communities, considering the system factors, such as the determinants of health, and then lastly and importantly, ensuring that each person's unique needs and preferences in care are addressed to help that person live a healthy life, either with or at risk of chronic disease. So I'm now going to bridge the foundational work that we did to develop creating harmony in care, and then how we sort of used that or applied it to Kidney Health Check. So the main focus of the Alberta Kidney Health Check Protocol, as you heard earlier from Lena, is about screening individuals in Indigenous communities for diabetes, hypertension, kidney disease, and obesity, with a focus on people at risk of kidney disease. And then the other piece that's a part of the protocol is to achieve targeted outcomes, such as managing blood pressure and A1Cs, ensuring appropriate medication use, and then decreasing risk where possible through focusing on nutrition, physical activity, and then appropriate tobacco use, excuse me. So when we used creating harmony and care to co-design that Alberta approach, we added some pieces. And the pieces that we added were the detailed focus on the patient flow to and from appropriate care, specifically for considerations around primary and specialty care, and then access to comprehensive wellness programs, services, and resources, both in the community, in surrounding communities, and then also virtually. So this became our Alberta approach to Kidney Health Check. So this diagram outlines what takes place in the moment of screening for Kidney Health Check in Alberta. So in the moment, the person is screened and then assigned a risk level, as you can see by the stoplight colors at the bottom of the slide. And then based on those results, they're given a personalized plan and any necessary or relevant referrals. The pathway includes options for primary care, including specialty care for those with high risk. However, every person is offered the option for general wellness, regardless of their results. The patient is then informed of their follow-up plan and then if rescreening is required. This specific approach to the screening was co-designed with community, including healthcare providers, elders, patients, and other health system partners. And we were able to craft some unique pieces as a result of the planning conversation supported by Erin to capture key concepts in our conversations. And you'll see a little bit of that now. So this is one of the first images that Erin produced from a planning conversation with the healthcare team in Piikani First Nation, where we were learning and hearing more from Austin, who is a kinesiologist, and Rachel, who is a dietitian within the community. We were eager to hear from them, their perspective, what they thought would be helpful or bring about success from a screening program like Kidney Health Check in their program, or in their community, sorry. Some of the images reflect events or programs that Austin and Rachel were focusing on at the time, such as the Mo Bash and Health Fair. And we heard from them about the importance of getting people involved in these local events as a way to bring about that awareness of the screening, and then to also bring in the opportunity for that focus on wellness. This is an image from another meeting where we were learning from Harley about the important and sacred concept of the bundles that he was just sharing with us earlier. And we were starting to think about how that could be applied within the screening approach. And then emerging from that was an important focus on patient tools and overall wellness. And you will hear a little bit more about this as well from Leta in a second about the presence of the patient tools and the wellness model. This last image that I'm going to share comes from a gathering that we hosted with elders from Southern Alberta, and we were guided by Harley with an important focus on protocol and heard from the elders about many concepts that you can see were critical for us to understand about both the potential barriers, but also the strengths and opportunities that were coming from community to ensure that this screening is going to meet the community needs. So it had that balanced approach as well. So from those conversations and images, we were able to reflect those learnings within our Creating Harmony and Care approach, and then actually expanded on it to include several elements that were the key products. And some examples of that, as you can see on the screen, if you look in the person section at the top, we had the addition of My Health Documents, which is focused on the patient and their wishes or desires for their health journey. Around the care section on the right-hand side, we're building provider toolkits and then using the actual screening approach to meet that sort of bundle around care. For community, we were building a community wellness model, which is rooted in the strengths of the community. And then for the system piece, was the focus on the patient care journey and making sure that we had the appropriate pathways and the services available for patients throughout the screening journey. So I will now pass it over to Leta to share further on the elements arising from the co-design approach, including the wellness model and the patient tools, as well as more details about how Kidney Health Check is implemented and progressing now.
Thanks, Nicki. So on your screen, you'll see our community wellness model, which is focused on ensuring all people screened, regardless of results, have access to healthy lifestyle programs and services in order to prevent progression to or of disease. This also allows how we make the approach culturally relevant and meaningful to community members. The model focuses on 3 areas: the medical, which helps to manage disease; lifestyle, to help us live a healthy life with disease; and cultural, using cultural healing factors to live well. The model is intended to be a holistic snapshot of the various elements related to a person's health status, including the medical, lifestyle, and cultural factors. We co-designed this model with the Begunny champions and started with the specific targeted medical outcomes from the Kidney Check project. The model was built out from there to include considerations for lifestyle and cultural factors that could also contribute to an individual's wellness. This was the opportunity to highlight the fantastic work from the community health champions, rooted in providing a variety of programming and health event options for a person to explore their health. Next slide, please. As we moved into the patient tools that we talked about to focus on the individual or the person, this slide features 4 of the patient tools that are accumulation of the pieces we just reviewed: the patient report and the wellness model. Inspired by early conversations with the Begunny champions, we created a toolkit of resources a patient could have that would contain opportunities for them to learn more and plan out their health journey. It was important that the tools be person-centered and allow the patient to identify what and when they would like to focus on certain elements of their health and wellness. So the tool on the top left of your screen is called the Health Report, and that is the very first resource we shared, which includes the results from the screening. So there's a blood pressure result, a blood sugar or a hemoglobin A1C result. If there is a diabetes foot screening, that could be included. Eye screening and the kidney results are also, and they're just missing on the bottom of the screen there. And we integrated that stoplight approach for easy understanding of if it was no or low risk, moderate risk, or high risk. The second tool that has kind of the sky background on the left is a capture of the wellness model and a table that has community programming specific information. So an individual can pick and choose local events they may wish to participate in. The third tool with the image of the buffalo or the bison on it is designed to support a conversation regarding what the client would like to focus on in their wellness journey and help them set goals. And finally, the last tool is a resource, is a tool to help organize various appointments, contact information, and other important connections in the community. So it has different names of people, their contact information, and a place to write down appointments, date, times, and locations. Next slide. And so this is an image of what the screening equipment looks like and the space that it would take up in a health center or in a community space. So within Alberta, we've implemented 2 different models to carry out the screening, which have been co-designed and co-created based on the individual community's needs, resources, and infrastructure. Utilizing a train-the-trainer model, healthcare professionals attend a one-day session with the goal of empowering the local staff to coordinate and organize screening events based on the needs of the community or the team. For our communities in Southern Alberta that we've mentioned, the healthcare providers working within the local health centers attended the Train the Trainer program, which has enabled them to independently offer screening to all community residents. While the champions connect with us for troubleshooting, supplies, or other questions, they run the screening program on their own, including scheduling the screening appointments and events, conducting the health coaching with the patients, and maintaining the equipment. Early on, this was their preference, and it was shared from the communities that they have their own approach and access to the screening as they had the time, physical space to maintain the equipment, and a willingness to commit to the program. For some communities in Northern Alberta, we've been testing the implementation of a mobile screening team, which is led by Okaki and supported by members of their virtual diabetes education program. This team travels with the equipment to remote communities across Northern Alberta. The team schedules the screening events in advance, sets up the equipment for a few days at a time to capture as many individuals as possible. The locations of the screening can vary depending on the community. However, it has been hosted at friendship centers, community halls, or healthcare centers. As I mentioned on the screen, you can see an image of the equipment that we utilize. There are 2 DCA Vantage, which one will test a hemoglobin A1C and one will test a urine random albumin creatinine ratio. Another machine will test a capillary creatinine to help identify patients' risk of kidney disease. There's a blood pressure machine and cuff. The reagents, cartridges, and control solutions to support the equipment are included. Supplies to perform the point-of-care tests, such as lancets, urine collection cups, personal protective equipment are included in the study. A fridge, thermometer, and coolers to help maintain the quality of the reagents and control solutions, and travel cases to transport the equipment are all provided, whether it's to the mobile team or the community time, so they can move the equipment where it is needed the most. An individual screening appointment lasts about 20 minutes from start to finish, including in-the-moment screening results with the opportunity for health coaching conversations. Leveraging the National Kidney Check Protocol and partnership with Shared Health Laboratory Services in Manitoba, the screening equipment adheres to the established quality assurance and quality control protocols. Next slide, please. On this slide, you'll see a capture of our total screening results to date in Alberta, including both baseline and 6-month screens for individuals who've come back. There has been more screening in 2026. Just some of those, they've been doing lots of screening over the last couple of weeks, and some of those data points aren't there. But over the last 3 years, more than 500 individuals have been screened in Alberta. Next slide, please. As this project has wanted to understand the participants' perspectives, the individuals participating in the screening and the healthcare providers offering the screening, you'll see some quotes on our screen that will help you understand what has been shared with us. However, I want to take a moment to share with you what we've observed and heard in attending the screening days and our follow-up conversations with community. And these are ideas and comments and feedback that we've heard that you won't find in a survey or a focus group interview. We've witnessed shoulder drops in size of release from participants when their results are shared with them. A tear when a story is shared about a family member who lives with kidney disease and attends dialysis appointments. A thought said aloud from a member being screened in the community about not being a burden to their family or the community, knowing knowing their results now. The smiles, the jokes, and the laughing before the participants say goodbye to their friends and community members after a screening, and the healthcare providers high-fiving each other on a job well done at the end of the day. And I'll pass it back to Lena to talk more about our lessons learned.
Thank you so much to the team. So I'll bring us back and just share some of the lessons that we learned from the co-creation of creating harmony in care and those early days of implementing kidney health check. Oh, we just lost the lights. Sorry, we got some blinking lights here. We learned that the process is a product and that the communities have the wisdom and the answers to address their local health challenges. We learned that we need resources to do it right and to support the people doing the work. And we learned that using stories and graphics work. We also learned that relationships are the deliverables and we need to work across jurisdictions, and that it takes time to truly engage, build trust, and collaborate. Next slide. We learned to work one community at a time and to provide sustainable support for community champions and to build local capacity for long-term sustainability. And we learned to work one person at a time, to listen to and to include elders and to enable continuous and reciprocal learning. And I just want to highlight that the image on the left is a version of a traditional winter count that we created from the 2 years of collaboration, sharing, and storytelling with the Bagani community that you've heard about. And then the image on the right is Conrad's story. Conrad, who was a young man living with diabetes, severe malnutrition, kidney failure, and amputations, as we tried to support him and his family in bridging the gaps in care that he had fallen through the cracks of. And both of these images are about giving back and building capacity within the community and within the person and the family. Next slide. So these lessons are informing work we're now embarking upon in Women's Health Alberta and Alberta to co-create harmony in care in Indigenous women's health. So this work is intended to identify complex factors that impact health and healthcare experiences for Indigenous women in Alberta, to recognize elements that support a strength and healing-focused approach to care, and to co-create solutions to achieve equity in care. This will lay a foundation for Women's Health Alberta to inform health policy, to facilitate the creation of culturally safe care spaces and environments in acute care settings with a specific focus on Indigenous women. It will help us to establish the requirements for developing trusting relationships with healthcare providers in primary, acute, and specialty care settings, and to understand and highlight the distinct cultural differences among Indigenous women in Alberta. And so that wraps up our formal presentation. We can go to the next slide. And then Harley, I don't know if you will briefly close us out before we open up for questions.
Yes, thank you. Yeah, I just wanted to, use traditional protocol to end this part of the presentation and focus on recognizing those gifts that the Creator has given us all to use in our lives to keep our journey focused and strong moving forward, but also the many things to be thankful for, be able to work together, be able to share, and be able to co-create what we need to improve the health of whether it's our families or our communities. So with that, I'll just say a short prayer. Creator, Grandfather, thank you for this day and this opportunity to be able to come together from many places across Mother Earth, be able to hear those stories, be able to share the processes that have been put in place and the models that are helping. Creator, we give thanks because we're thankful for many things you've given us in our lives. The medicines and the sacred plants, the ceremonies, the songs, and be able to come to you in prayer that also help us in that journey and have of health, to be able to be strong, to be able to help other people who are struggling. So Creator, thank you for this day and for everything that you've given us, and watch over us and protect us. may we walk in beauty, all my relations. Thank you.
Thank you so much. And then I just want to acknowledge that Dr. Bello was able to join us throughout the presentation. So Dr. Bello, I don't know if there's anything you would like to say before we open it up for any potential questions or
Thank you very
comments.
much, Lene. I'm so sorry for joining late, but I was summoned to the emergency room. I've been on call. I'm glad I'm able to make it to catch up with the rest of the presentation. We thank the organizers for the opportunity to be here today to share this kidney check project in Alberta, which had been ongoing for a number of years. And we have been working together with other colleagues across the country from coast to coast to coast under the initiative of Council. So I saw a question already. Order is running in other parts of Canada. Yes, it's happening. It started in Manitoba and it's being run in Saskatchewan under the leadership of our leader, Dr. John Capel, who is here in Alberta, as well as in British Columbia, under the leadership of Dr. Adra Levin, formerly announced. I just handed over the program to my colleague and friend, Dr. Anurag Singh, who I've seen here today as well. So we sincerely thank you for the opportunity to present the program here. And I would really like to acknowledge our team for this outstanding presentation and for their continued dedication to this important work. The people you listened to this morning actually is the engine of the project. We're just behind the scenes. They've been running everything. In particular, my heartfelt thanks go to our Elder Harley Crowshoe, Lena, Leta, Nicki for their unwavering commitment and leadership. What began actually as a small initiative, as a model that was developed in partnership with the Pekani Nation under the leadership and guidance of Mr. Crowshoe that you listened to, has now evolved into an approach, an excellent model that is currently benefiting many nations across to develop kidney prevention program across Alberta and beyond. I would also like to acknowledge the presence and contribution of several individuals who have supported this initiative through the various leadership role and operational role within the Council CKD network. I see Maureen Loss here. I see, of course, I mentioned Dr. John Capel, Selina Lu, and their guidance, partnership, commitment has been instrumental to the overall success of the program in Alberta and across the country. As you see, the core strength of this initiative is actually our commitment to share knowledge, to share experiences and wisdom gained through this work with other communities, other stakeholders, researchers, policymakers across the country. So we continue to disseminate all these lessons through presentations like this. That's the reason we're so appreciative for the opportunity to be in this important meeting and several other related local, national, and international engagement, as well as external communication in the form of scholarly publication. We just shared one of them, manuscript describing the program development and operation outcome metrics, where we are, published in the Canadian Journal of Kidney Health and Disease. We have another one currently coming up under review on that we worked with the communities, Black Tribe Nation, Pekani Nation, to share their experiences regarding the program, benefits, challenges with implementation, and what can be done about it, so that we share it out with others, so that they can learn something and we also learn from them. So thank you once again for all of you for your partnership support and shared commitment to improving kidney health outcomes for our Indigenous communities in this country. Thank you, Lene. So we're ready to questions.
Yeah, I don't know if there are any, and sorry, I'll leave it to you, Chloe.
Oh, no worries. Thank you, Dr. Bello, and all the speakers for such a wonderful and very rich presentation. I think there were a few questions in the chat, but maybe I can summarize them together, just kind of on that last point about implementation and the kind of next steps perhaps for the project and or the model. I guess like how it was put, kind of the part of the findings and the relationships are the deliverables, and that it's one community at a time. I think you also lovely put that, and one person at a time. So I guess maybe if you any of you could speak to some of the next steps for implementation in different communities or different contexts, and any implementation barriers that perhaps you've experienced as well.
Well, I wonder if Leta and Nicki, I'll hand it over to you to talk about how we're really expanding into the northern geography.
Yeah, I can start that off. So actually, kidney health check across Alberta is expanding quite a bit. One of the communities that was accessed by the mobile screening team has actually and is in the process of implementing. Will be They started the first half of their train the trainer, and we'll be doing the hands-on equipment training in a couple weeks. But we're moving into the Wabasca Big Stone Cree First Nation community the end of June. After that, another community that had mobile screening up in the kind of northeastern geography of Fort McMurray. We are in the early days of talking about what implementation would look like there and bringing equipment to 5 smaller Indigenous communities around that geography, and how that could work for them. And it might be a bit of a hybrid model where they share the equipment because they're quite small communities, so they can offer screening to each community when is needed. And so we use that train the trainer model so that those community members can offer the screening, care for the equipment, and support their community members when and as needed. Lots of the tools can be shared. They are somewhat community led and specific. So some of the images may look different if you're from Southern Alberta compared to Northern Alberta. You may not see as many mountains up in Northern Alberta. You might see more trees and lakes, and some of the imagery or some of the wording, because Cree, Dene, Blackfoot languages are all specific to each of those communities. So those could all be adapted, but those core concepts of sharing the results, goal setting, the community wellness model can all be adapted and customized to each community.
And maybe I'll just talk a little bit from a system point of view, because Alberta has gone through some refocusing activities over the last few years. So we've gone from one integrated health system to a number of pillars. So the team that has been working with Dr. Bello over these years on the work that we've just shared today, we have moved into what's called Acute Care Alberta. Our team is now focusing on women's health. So we are working very closely with Primary Care Alberta, which is really where prevention and screening is sitting. And so we're working to create an Alberta protocol for the lab, the QA/QC, and a standard of care for the screening in Alberta, really with the intent to fully implement it under the Primary Care Alberta program. And then, like I mentioned, what we'll be doing in Women's Health Alberta is to take the approach and hopefully expand it, like the screening slide that you saw Nicki go over with the stoplight colors. And we really want to expand that into more women's health specific screening opportunities that can take place in a similar manner in communities.
Yeah, amazing. Thank you. We look forward to hearing the updates on those next steps. And I see Sandra has a question as well, so I'll let Sandra ask.
Yeah, thank you. Not a question. I just want to leave a statement and something for us to all think about. First of all, this is amazing work. I'm familiar with this program and the work that you've been doing as the lead of CDT-RP long-term outcomes. There's a couple of things and this is the whole point of bringing this all together so that we can learn from each other. And, prevention is something that we really need to look at from CDTRP's point of view because of the lack of transplants. But we also don't want to get people to dialysis. And as a dialysis patient, I'm fortunate to do it at home, but I've been in many clinics. And when you see people that have amputations or wounds and things, and you think, how did it get to that point? Right? And so these kind of things with the checks and stuff. So I love to see this across Canada and across, like, it doesn't matter what culture, all cultures and that. The other thing I really like about it, and it was a wheel that you did, and I really think that, Western medicine can learn from the wheel. And this is something Chantel and I, the lead from Theme 5, want to focus on, is a holistic approach. So the wheel, I don't remember exactly what it is, but you had the culture, the wellness, but it's all the things that, like, I refer to also as well as social determinants of health. You had at the bottom, like, the community, the nutrition, the exercise. And those are all the things that our primary care doctors should be looking at, as not just like the status of our kidney function or our liver or stuff like that. So excellent work, and excellent work with working with the elders and working with your community. And I just wanted to say kudos. But yeah, we're learning a lot from the work that you're doing. So thank you.
So I'll let Leta just answer the question that was in the text box, and then I want to make sure that we have a minute at the end to share what Aaron has been doing in the background. So Leta, go ahead.
Yes. So we have one very small and mighty mobile team that goes across Alberta. It consists of one nurse and two dietitians with Okaki Health. And they have great relationships with many Indigenous communities across Alberta, as they offer a virtual diabetes education program. And so they'll reach out to their community contacts and offer and work with community health leaders when they can join the community for a screening event, when it might work with them. And they bring the equipment, they offer screening for a few days and help support any referrals that might need to be made. Regarding the train the trainer model, the community members, they are primarily healthcare providers, so nurses, dietitians, kinesiologists, community health representatives, community liaisons, home care team members. It really depends on who works in the community, what community members may be available. Sometimes it's even medical transport teams that attend, but it can be quite community dependent to figure out who might be able to offer the screening and support those health coaching conversations. But typically it takes a small but mighty team in each community to help roll out and offer the screening.
So as we close out, you've kind of seen what each of us, the role we've been playing in the creation of this project. And quietly behind the scenes, Aaron Russell has been doodling what we've been talking about today, similar to how we embedded that skill and art within our co-creation project. And so again, Aaron has been capturing what has been said. We will share this image with the organizers. And with that, I would just like to sincerely thank you for inviting us into this forum and for taking the time to listen to what we've been doing in Alberta, which is something very near and dear to our heart. We love sharing what we've been doing. And we're really grateful to you that participated today. Thank you.